session. All welcome to our great platform from the different parts of the world. Today, our 1065th day of uninterrupted Zoom session. Now, before starting today's our guest is Dr. K.P. Madhusoodhana Panicker. He is an eminent doctor, a very humble, very wisdom sharing person and knowledge sharing person, and such an important person. He had done so many talks in our session, and for him and for all the participants who are sitting here. So let us have an audience silent prayer. Thank you all. Now, Dr. K.P. Madhusoodhana Panicker, retired CMO, Department of Homeopathy, Government of Kerala, Chief Consultant, SN Homeo Hospital, Kattur, Kalavur, Alapura. One of the most wanted faculty from Kerala, conducting regular free medical camps on every Sunday, more than 45 years of experience. Today, his subject is management of psoriasis with homeopathy. We know that psoriasis. He had done so many classes in cardiology and general medicine, and now he is touching the most important skin disease, psoriasis. We know that there are several types of psoriasis, and sometimes it may be very difficult for a patient to a doctor to manage. Now I welcome Dr. Madhusoodhana Panicker, sir. Sir, you are for the next 45 minutes will be your class, and today of shortage of time, let us go with hurry. Thank you, sir. You are welcome, sir.
Good evening to all of you. Pranam to my Bhagavan, my Guru Samal Hanuman, to all of you. Today's our subject is the treatment and differentiation of the different type of skin lesions, especially in psoriatic eruptions. First of all, you start with please, sir. Skin sharing, please.
Okay, sir.
Okay. Have you heard me? Have you heard?
Yes, sir. Yes, sir. We can hear you.
Okay. Today our subject is psoriasis. I arranged the program with an audio-visual class where we can see the indicated medicine and how it is differentiating, and we can discuss about the extraordinary characters of the skin. So first of all, I have to talk to you that in psoriasis, each and every medicine, first of all, we have to differentiate the type. Is it psychotic or psoric or psychosoric or tubercular or syphilitic, with all characters. The main characters are itching, without itching, scarring, without scarring, hard scar, single scar, itching and burning, itching only without burning, discharging serous fluid, milky fluid, oily fluid, offensive fluid, acrid fluid, bloodstained fluid, medicine which are related to this psoriatic eruptions. We keep a book of treatment and differentiation each and every. For example, in croton declinum, we have the itching, psoriasis, which when we return from our clinic or from office or any from outside journey, come here with an, when we become undressed, severe itching of exposed part. After taking cold bath, it aggravates. But the scratching induce burning and painful. But gentle rubbing get relief. Only the crotondiculum psoriasis, the itching eruptions and the itching and burning subsided by gentle roughing. Slight friction aggravate. After we change the dress, when we wear dhotis, it will put certain friction when we walking. So it aggravates. That is a crotondiculum. If in Pagopyrin, it is undressing aggravation with burning, but the thing is that with the stiffness. But stiff feeling of not the musculature but the skin after scratching. That will be get relieved by cold bath. But each and every minute differentiation in the symptoms will differentiate the medicine. So first of all, there were common findings in psychotic lesions. It is thick. Crack is comparatively painless, hard, colder relief, odd patients, aggravation in cold season, aggravation in hot season. Even it is in syphilitic, the discharge is itching with the bloodstained discharge, blackish or brownish discoloration, itching aggravation night, warmth aggravation, change of climate aggravation. But so you differentiate the skin and symptoms. Before you prescribe, you have to undergo the minute changes, even in symptoms, we have to study thoroughly. Then we can cure the psoriatic severity of the psoriatic disease. And we can click on our specific medicine for within short time, in 1 month or 15 days. So I always give medicine for 15 days. Then if it is acts, we can continue it without any fear or any fear aggravation, with confidence. If there is improvement, I only give PL. Otherwise, I will change the medicines. Or if it is slight improvement, slightly improve the potency.
Sir, the slides are not moving, not
Sir,
changing.
only the first is with talking the preliminary indications for the treating is. Sir, first of all, it is a case of deep psychotic eruptions. The X-ray, cerciparlan, petroleum, it is indicated in 3 miasms. The X-ray is a deep psychotic miasm, the hardness, the existing without any changes, no marked discharge, no marked pain only aggravation in hot season and hot things. Also in cerciparlan, the acute inflammation of the chronic, if we treated, or when they are going to Delhi or other Idiki, damn cold places, it is reappear with a slight pain, slight bleeding, not marked thickness, but it is painful, aggravation that time, amelioration night time, so many. The sweat has got sour smelling sweat. These are the psychotic sorrow, tubercular indications of the cerciparlan. If the petroleum, the other medicine for deep crack is petroleum. In petroleum, the main indication is itching at night, dry skin with the moist, clear watery discharge, with the burning, constricted feeling, rough cut, leathery appearance. In leathery appearance, like rubber of the tire of car and bus. It is formalin. Formalin, very deep, thick, cracked, like leather, or like the part of tire of the vehicles. It is formalin. In petroleum, after itching, burning, and severity with painful and become separated. The only differentiating point is clear water, watery discharge with the burning aggravation night. The most find out personalities are drivers or the person who are working in petrol vehicles. It's an indication for it. Commonly, they have heartburn. Heartburn frequently desire to eat. Eating relieves. Eating warm water, warm food. Or same, if it is in iodine, the cold water and solid food relieves. If in anacardium, any type of food taking will relieve to heartburns. These are the comparative materia medica of petroleum. Then the psoriatic inversa. In modern medicine, the psoriasis inversa, versicola, psoriasis dispo, so many type of but we can prescribe without the pathological differentiation, but only the symptomatical and the appearance. We can easily enter the corrective and correct medicine by seeing the lesions. The most medicines are most acting effective medicines. These type of lesions are on one mersol, then the arsenic iodide and the phytolacca. Mersol is syphilitic, arsenic iodide is psychic, tubercular, syphilitic, phytolacca. In mersol, the itching aggravation night, bilateral, brownish color. It is reddish color. All the reddish eruptions are tubercular. So when we get a psoriasis for highly red color, beyond the appearance, you have to prescribe as tuberculum 061 dose night. Then within short time, it will change the character and we can give the good picture of exact the lesion behind. So any lesions, if it is bilateral, we think of syphilitic medicine and it is mainly on fold. Not marked thickness, only thickness is in the side. It is a basic symptoms of tubercular lesion. The center lesions is thick, dry, rounded. The arsenic iodide. Arsenic iodide is there is no discharge, but it is large scale with itching. The patient sleep with the covering and taking cold things. The acute medicine of phosphorus. Certain special cravings are with arsenic iodide. The main symptoms are extreme nauseating nausea when cleaning the teeth. So very rare Canadian symptom. It's very effective. You can find it in liver cirrhosis and other influenza like fever. When they brushing the teeth, the severe nausea. Then arsenic iodide, if itching, the itching cause discommission of the scales, large scale underneath after discommission, the blood stained clear watery discharge. It is arsenic iodide. The phytolacca, sweat aggravation, cold aggravation. The phytolacca always with the redox modality and the bryonia modality equal. Resto aggravation is moment of aggravation. Extreme sweat, glandular swelling with, all these are the symptoms of phytolacca. Then psoriasis. The flavors like. What is flavors? In colloquial language, there is a fruit. The external appearance is like this. What is the name of fruit? Ramphal, Sitaphal. In North India, they are referred as Ramphal. In our Kerala, it is Atachaka. The fearful. In Malayalam, it is referred as Brahmalmakamaya. Brahmichu. The fearful appearance. The only and the wonderful medicine is Ethiopiasis mineralis. There is no discharge from only the things part by part, thick and hard. The first of all, it appearance in white scar, then it blackish or bluish, reddish. Even this also with the asthma, we can try with arsenic iodide. It is guttate psoriasis. Guttate psoriasis, the specialist is, it is appear in the entire body, small and big. You have to see the picture. Spotlight, scaly, white scale, red scale, with itching and day and night, aggravation, exposed to cold air, relieved by warm bath, better in walking outside or journey or going out of house, aggravation inside house, moving or undressing aggravation, moving relief. The other medicine is ammonium carbonate. Most probably, the asthmatic symptoms with the skin diseases, especially the symptom aggravate 4 to 6 a.m. with extreme obstruction of nose, leading to sneezing and other bronchial symptoms associated with piles with the drop by drop bleeding, chilly patient with the fear and anxiety with the car. Then it is also better in vitiligo, bilateral or semilateral, itching better by lying on the affected part or covering and dressing. Undressing, dressing, I especially try to study about vitiligo, restox, natramol, comparative material. Then sulfur is a extreme hot and extreme chilly, opposite of sorinum. Aggravation by bath, aggravation by standing itching, itching with a severe burning. The comparative study of sorinum and sulfur is there is no burning in sorinum, but burning with itching, it is sulfur. Gentle wash of warm water relief. Then Anandramor is a very good medicine. It's a tubercular medicine. So the small nettle rash like appearance with reddish. The redness is like Vagapu, the flower of Vaga, we can see inside the roads. Extreme bright and reddish, deep red appearance with the small and small eruptions. Commonly, we have got an extraordinary symptoms in Anantharamor that want to attempt the desire, otherwise the urine is passing unnoticed. It is a very good medicine for prostate or in fibroid uterus or any pathology, anything with uterus or prostate. These symptoms is predominant. The medicine is Anantharamor. The other type of psoriasis, geographical pattern. We know that under the pathology, mental stress, disappointment, griefs is a one of the main cause for psoriasis. So with the silent grief, brooding grief, with any misfortune in the family, with the death of loved one, or financial loss, or loss of any intimate things, with a family history of psoriasis, it can be appear in the new generation as like this. If it is with the geographical pattern, the echinacea, if it is with any family history carcinosin, if it bilateral appearance or any alternating symptoms, the itching with numbness, the agarus is the best medicine. Then the natramor, also with the, we can know the griefs of natramor. Aggravation in seashore, craving for salt, cold bath relief, outdoor relief. These are the symptoms of this our beloved natramor in the geographical pattern psoriasis. There's malignant psoriasis. In certain type of cancerous conditions, if there is any family history of psoriasis in their home, with the cirrhosis of liver, or any extreme splenomegaly, or any with any cardiac disease with low platelets count. This type of psoriasis so common. With the pathology, we can give both drops lactinators. The pathology of heart or brain, especially after stroke, especially after frequent stent application. In extreme dyspnea on exertion with the cardiac pathology, we can try with both drops lactinators, thick, hard, scaly, whitish, pitching or without pitching. Then our callias. A silvery appearance, silvery crest in patients who are working for a strict schedule for a certain period in favorable circumstances. Especially it is indicated for soldiers working in military, prolonged after continuing strict time scheduled hard work. When they return from service, they have to attack with psoriasis. It is our callias. It is a combination of Kali and Ars. So the aggravation most probably even in pleurisy, even in lung pathology, even in headache, even in any pathology cancerous with 12 to 4 aggravation. The Kali garb is the best medicine. Another clue is for get relief by lying on left side. The time modality, the previous history of strict schedule, and malignant histories with Ars and Kali symptoms, we can use it in any pathology. I have got a pleurisy with the lung cancer. In my last week, the entire pathology is aggressive. They are doing aspiration of pleural fluid and doing sensitive test, but no modern medicines and antibiotics is effective with us. So the treatment, the doctors are advised to and explain the unluck of the treatment. and they called from Kozhikode. I sent a few doses of Kalias 0.3, 2 pills in a powder form for 30 powder. I sent it. And they start the medicine next morning. Within 2 days, the entire suffocation is reduced. After 5 days, the X-ray reveals that entire, most about 70% of the fluid is absorbed. The dyspnea is better. And all the pathology is upset. I am going with the PL now. It is our beloved Kalias. It is also a type of inversa, psoriasis inversa. The medicine is graphitis, petroleum, and sarsaparilla. We have discussed already the petroleum and sarsaparilla. The graphitis, the special symptoms. And man says that the graphitis married all miasms. So the symptoms are combined with the sticky fluid discharge of the psychosis, acute chillness of the psora, and the destructive skin with the cracks, painful cracks, thickening of the ugly looking, unclean appearance of the skin, thick, darkish, with the crack and discharge, honey-like discharge. Often see honey-like discharge. No, 3 symptoms are always associated with the graphitis. One for constipation, then next is with the gastric troubles. Even any complaint, when we get hungriness, get relief by eating food, all gone feeling, get relief by eating food, dyspnea, get relief by eating food, chilly patient, warm food prefer, constipated with gastric irritation and acidity and heart pain, with the sticky discharge, the most and definite medicine is graphitis. In my experience, so a lot of failure with graphitis in my early period. I only use 0.1, 10 pills in 1 ounce water, 1 ounce aqua, and take it 10 drops 4 times daily for 1 week. If the symptoms improve, I would stop it and give PL. Definitely severe aggravation. Even petroleum, if it is, we can use in any potency, any succussions or any form. Addicted 4 or 5 times, likewise, there is no aggravation. But in graphitis, it is very, very sensitive medicine. So use with caution. This is plaque psoriasis. You see the picture, bilateral. You can see in syphilitic eruptions, with the crusty, with the psychotism, syphilitic, it is cracked and bilateral. So the predominating miasms are 3. It is plaque like psoriasis. Yes. Hello. The first is lobelia inflata and formica rufa. These 2 medicines are very useful at Athicaria with plaque. Large. Okay.
Sir, please.
Yes, you see the picture. Whenever the patient came to our chamber, you have to watch the appearance, the circumstances, and the margin, if it is scaly, or it wet or dry or cracked, Each and every symptom you have to study well and compare your knowledge with material. It is tellurium. You give 202 pills one time or use 0, 2 or 3, 2 times or 4 times. This type of psoriasis, there is no need of any external application, but if you are interested to give to subside itching or likewise, you have to apply. In my experience, I used coconut virgin oil with the pipermethacum tincture. In 100 ml coconut virgin oil, I use 50 ml of pipermethacum tincture and do it as succussion and apply. It is a very good medicine for subsiding the eruptions of thick eruptions of scalp and also the body. There is no need of it. If the indication is best, it will vanish by washing out, like effect we will get within short time. If the medicine is most indicated.
Sir, you are muted, sir. You are muted.
ദിവനെ ഒന്ന് വിളിക്കണം.
Now we can hear, sir. We can hear you, sir.
It is not moving, sir.
Oh, yes, yes, sir. That's right. Sir, please unmute, sir. Sir. Okay, okay, sir.
It is not moving. Stop sharing. About tellurium. That's basil. You see the difference. The lesions around the ring lesion, it appears the entire inner, the circle is free from lesion. The side of the lesion is thick, cracked, reddish, irregular. Slight difference from tuberculinum. Basically, our chilling medicine is tuberculinum and most hot is bacillum. The aggravation is likewise. You see the tuberculum. The cracks is outside the margin in bacillum, but inside the margin is tuberculum. You see the surroundings. It is irregular. Upper side thick, inner side soft. Inside the lesion is completely free. Also, it is in bacillum, it is also likewise. With the severity. Bacillum night aggravation, tuberculum day and cold weather aggravation. Psoriatic ulcer. It is a malignant psoriasis. Eruptions, perspiration relief. So the sorinum and radium bromide, these two medicines are only get relief after sweat. With ulceration. In graphitis and in radium bromide, there is ulceration. But thing is that whenever there is an history of exposure to radiation or any continuous exposure to X-ray or MRI scanning or work in extreme heat, like our pujaris of temple. If there is an urticaria or eruptions, relief by hot bath. The underlying lifestyle and the pathology is the main indication of radium bromide. Not in psoriasis, but in the advanced stage of cancer, especially breast cancer. We can get the, you see the left picture, the shriveling or wrinkling in the skin of glandular cancers, especially in breast with the ulcer. More indicated if it is in dark, easily bleeding, offensive. The wrinkling, dark ulcers, not easily bleeding, painful or painless with the adjacent lymphadenitis. Dryness, non-ulcerated part, there is fish scale like scales. Also with the crack. Other than cancer breast, it is aggravation in winter. Skin navy, skin tag, vitiligo. The vitiligo is a psychosyphilitic symptom. Radium bromide also a psychosyphilitic nature. If any underlying pathology or lifestyle in those type of exposure, we can definitely give radium bromide also for vitiligo. The other flow of the radium bromide is steroid-dependent rheumatism or asthma or any disease with the frequent use of steroids. The patients who are with nephrotic syndromes, if the psoriasis appear after that, the radium bromide is the best and one of the medicine. The other special flow for it is relief by cold application. Burning, itching, bleeding, even with wet packing, get relief for it. So any ulceration, if it is with any pathology, we can use Echinacea wet pack. You put 10 drops of Echinacea tincture in 1 ounce water, plug out with gauze and apply in the ulcerated part. It will subside without any infection and our medicine will act speedily. Within short time, the bad smelling discharge will stop and patient get more relief. The other two medicines, even with the cancer or any ulceration or a chronic unhealed ulceration, if the pain and burning get relief by cold application, the first medicine is radium bromide. The best and deep psychotic medicine is fluoric acid. Syphilitic medicine is fluoric acid. Other psychosoric is pulsaril. Any chronic ulcers take long time for healing. means unhealed ulceration. With this modality, with or without any maintaining cause, I tell later, previously, we can use radium bromide. The specialty is radium bromide, any joints pain, any pain, rheumatic or inflammatory or any after injury, there is a aching with the cracking. Aching with the cracking is a main clue for radium bromide in rheumatism. Especially rheumatoid arthritis, osteoarthritis, with a steroid using history, the best medicine is radium bromide. It is also a very good medicine for fibromyalgia, undiagnosed myalgia, suffering with psychosoric constitution, with the prolonged sufferings, griefs. They become painful even to touch the body. There are a lot of sufferings with aching pain without any cause or any diagnosing hints. We can successfully use our radium bromide. The most medicines Madhusoodhana and Tuja. These are the main follow-up medicines in rheumatoid arthritis and this type of psoriatic arthritis and all this. Psoriasis with cardiovascular diseases and with the varicose carboanimalis. The main symptom is blackish discoloration. Anything disturb the circulation, varicose vein or vascular arterial stenosis, with the coronary artery diseases, with the stenosis in artery or blockage in artery, undergone stent application or open heart. If there is any psoriatic eruptions, we can first of all advise carboanimalis. 0.3, I always using 0.3 in aqua or in powder. Within short time, it will gives good result if it is indicated. Whenever cries Robin, you see the always in genitals and around the ear and around the nose and in skull. Dry, scaly, cracked, inflammation with adjacent part, which is inflamed. Most probably, the eruptions appear in cartilaginous structure and genitals. If the eruptions, the rare watching clues. If the eruptions is white appearance, the first drug of choice is arsenic. Get relief by warm application with anxiety, night aggravation, warm washing relief with arsenic symptoms. If the psoriasis, if it is unilateral, bilateral, or ars is very good. If it is yellow or a psychosyphilitic, it is our calcium. In persons with, they are engaged always in household work. Very sincere to family members. Get relief by going for public. Prone to affect bronchitis or lung conditions. With the psoriasis, escalicarb is a best medicine. If it is bilateral, nitric acid, sarsaparilla and phosphorus. Only in spot, psoriasis in reddish spot with the crack, nitric acid. In repertory, it is referred as isolated eruptions. If it is appear in clusters, in group, it is another mode. If it is scaly, hard, thick, but not cracked and rough, it is shiny. The Euphrasia stipendis. If it is brown-like, after reaching, it is flower out easily to the floor. The first medicine is with the fear, dark, obese, calcareous. If it is with discharge and itching, creosote, and phytolacca, then silage. The patient
Oh,
prefer
now the, now the-
covering
now the
chilli.
time is
over.
okay.
Okay, we have to finish. Eruptions in clutches, agaricus and calcarica. Coppery, Carbonimelis, Soranum, and Mersol. On covered part, Ledum, Thuja. Discomatic, the eruptions easily falling out. Soranum, Sepia, Mesarium, ammonium carbon, Calisol. Discharging, Carboys, Grappages, Camera in 4 miasms. Sora, syphilis, psychosis, and tuberculosis. Discharging eruptions has got 4 medicine, 4 miasm. If it is fetid, soranum, sulfur, sepia, and malso. If the eruptions is flat, large, lacusis and belladonna. If the eruptions is granular, small, not small, but it is granular, slightly large eruptions, carboys, restock, and abaricus. If it is grape-like, calcareous, ugly looking, apart. The ugly looking, otherwise we referred as uncleaned appearance. On the soranum, the second is sulfur, the moon is apart. These 3 medicines are sorry. If it is appearing brown color, it is the best medicine. If it is in petroleum. These are our study about psoriasis. If we prescribe with the miasmatic totality and symptomatical totality and patient's craving, easily we can differentiate it with the cravings, spicy or sour or bitter, any dreams, if the mind is active or sluggish, or weeping or stout. These symptoms we can add to the repertorization and differentiated easily for it. These are our study and description of treatment of psoriasis. We made it out so far, our can cast.
Thank you, sir. Thank you very much for. Please stop the share screen option, sir. Share screen option.
Share screen option. Stop share. We can. What I have to do? New share.
First, Dr. Danesh, please close the share screen. Okay. Then now, Dr. Jayalalitha. Yeah.
Respected doctor, it was
Yes.
excellent session. I want to know about you told that peppermint tincture, a combination of with coconut oil. Give me
Yes.
the ratio of that combination.
In 100 ml of virgin coconut oil, you have to add 30 ml of peppermint.
Once more, 30 ml tincture and
100 ml, you have to remove 30 ml from that bottle and you add it.
Okay.
Okay, then it is mix again and again in each time of each use. Have to puzzle with it and
Okay, doctor. Thank you.
yes, welcome.
Anybody want to ask? Please raise your hands.
Yes. Good evening, sir. It's a very nice presentation and really an excellent topic you covered. And as the time is running out, I am just congratulating you for the very good session, sir. Thank you very much.
Thank you. Thank you very much.
Dr. Rini Anil.
Anything more about psoriasis?
Sir, about what about the ringworm infection that you have given basilinum? Which potency, sir?
Sir, best in skin diseases, we have to use best 0 gram, because in asthma and skin disease, lot of aggravation we have to face. To avoid aggravation, the patient will stand still with us. We can try 2 or 3 weeks or repeated or change of medicine. When we give a high potency, it may be aggravate. So the patient left us. In remain infection, 2 things there. The one is fungus. In genitals, it is due to fungus. If there is any fungus infection with the psoriasis, the best medicine is sepia. The other with any discharge or any crust forming with yellowish, sour smelling or hard smelling or foul smelling, kali sulfate is the best. You have to watch about the miasm, which the patient undergo. Then the chrysrobin is a very good medicine if the eruptions is thick, especially in genitals, on covered part, sweaty part.
It
If
was
the
on the
patient is, if we ask to expose it, if the patient is made up.
Now the time is almost running out. So, sir, thank you very much for always your great class and very studied, well material. You are all the time you are making good classes. So we are very much grateful to you. Now this is the time for starting our Malayalam session. It is too late for us. So I invite Dr. Danish to moderate the next Malayalam session. Thank you all. Here concluding our English session. Thank you all.
Tomorrow we will have a session from Dr. Gurukiran on repertorization. And with that, we come to the end of the English session, and it is over to Dr. Shaila to moderate.
Okay, thank you.